Hi, my name is Elaine and I'll be teaching you the proper way to check for the apical pulse and the radius pulse. First things first, you want to always do the proper hand hygiene. It's super important to do hand hygiene first. Once you've done hand hygiene, you want to go ahead and provide privacy for the patient. You want to identify your patient with at least two identities, such as their birthday and their name, and you want to confirm it with their ID bracelet. After you've done your hand hygiene, you want to go ahead and walk in the room. You want to greet your patient, introduce yourself, and let them know exactly what you will be doing today. Today, I'll be showing you this example on my patient right here, which is not a real patient, but I'll be trying my best to explain it to the best of my ability. So, you want to gather a few information. You want to know if your patient has any type of disease or anything that could be causing an abnormal pulse. Such as maybe a disease, heart problems, age, fever, etc. You want to gather the information first to know if your patient has an abnormal pulse. So let's get started. First, I'll be teaching you the apical pulse. So when you do the apical pulse, you want to reach for the PMI. So I'll be teaching you on my patient here. You want to get them in a supine position. You want to make sure to tell your patient you want to expose the left chest area. So when you are looking at the person's chest, you want to find the angle of Lewis, and then once you find the angle of Lewis, it should be right below the notch. So once you found the angle of Lewis, you want to go ahead and you want to go down to the second intercostal space. So with your finger, you want to find the second intercostal space right below the angle Lewis. So you'll go down. Once you're in the second intercostal space, you want to slightly go to the left, and you want to find the fifth intercostal space. Once you found the fifth intercostal space, you want to go to the second line in the chest. And once you have found the PMI, it should usually be about an inch or half an inch below the nipple area, but it's always important to count from the below the notch to the second intercostal space, and then you want to find the fifth intercostal space to the left to get the exact PMI. So once you have found it, you want to go ahead and get your stethoscope ready. So usually you should always make sure to sanitize before and after every single use. So once you have found the PMI, you want to go ahead and use your stethoscope. And then you'll be listening to the PMI. Great. So now I'll be showing you the proper way to look for the radial pulse. So the radial pulse, you want to get your patient in a supine position. Once your patient in a supine position, you want to go ahead and make their forearm lay in a flat surface. If they're sitting up, you want to make sure you get your patient to lay their forearm on the armrest. So once your patient's arm is relaxed in a straight form, you want to go ahead and go to the wrist area. So in their wrist, maybe it'll be more if I show you on my wrist, since my patient doesn't have the actual wrist here. So I'll be showing you on my hand just for an example. So the patient's arm should be in a flat surface, with their wrist facing downwards. So you want to go ahead and you want to place 2 to 3 fingers towards the thumb. You want to follow the thumb grooves, but beneath the wrist until you feel the strongest pulse. Once you feel the strongest pulse, that is where the radius pulse will be at. So once you have gotten there, you want to go ahead and count from the first pulse. So usually it It is about 60 to 100 heartbeats for a normal adult. So you would want to go ahead and count from 1. So you want to go ahead and check your you want to get your watch, and you would want to go ahead and listen to the first heartbeat. And from the first heartbeat, you would want to count to 30 seconds. Once you got to 30 seconds, you would want to multiply that number by 2. Once you multiply the number by 2, you will gather the information. You will know if your patient is having normal or abnormal heartbeats, because a normal should be from 60 to 100 heartbeats. So once you've done that, you want to go ahead and you want to sanitize your stethoscope after every single use. Is super important. You want to let your patient know how many heartbeats they had, if it's normal. If there's any concerns that there might be, you want to go ahead and let your nurse know if there was too many heartbeats or below the average. It's super important to note down any observations or abnormal things to let your nurse know at once. Once you are done, you want to go ahead and do the proper hand hygiene. Thank you.